Assalamualaikum. My name is Ellia Natasha binti Aliff Hymeer. I am a UPM student. So I have to do a video about the article that I choose for my task B, and the article that I choose is about breast cancer. So today I'll explain a bit about breast cancer and what you need to do about and what you need to know about the breast cancer. As we know, all women are very afraid of cancer, moreover breast or cervical cancer, because that is the important and sensitive part of women, is it? So yeah, I'm also scared. Breast cancer is actually the most common invasive cancer in women and the second main cause of cancer death in women after lung cancer. So the first main cancer among us women is lung, and the second one is breast. In 2017, around 252,710 new diagnoses of breast cancer are expected in women, and around 40,610 women are likely to die from the disease. Awareness of the symptoms and the need for screening is really important ways of reducing the risk. Breast cancer can affect men too, but this article I will only focus breast cancer for women. So here are some key points about breast cancer. As we know, breast cancer is the most common cancer among women, and the symptoms that include lump, thickening of the breast, change to the skin or the nipple. Risk factor also can be genetic, but some lifestyle factor such as alcohol intake make it more likely to happen. So a range of treatment is also available, including surgery, radiation therapy, and chemotherapy. And many breast lumps are not cancerous, but any woman who is concerned about a lump or change in your shape of your breast, you should see a doctor. So there are also early symptoms for the breast cancer. Usually the area will be under your armpit, okay? The lump in the breast or in your armpit, okay? A pain in the armpit or breast that is not changed with the monthly cycle, pitting or redness of the skin of the breast, like the skin of an orange, a rash around or on one of the nipples, a discharge from a nipple possibly containing blood, a sunken or inverted nipple, a change in the size or shape of the breast, peeling, flaking or scaling of the skin on the breast or nipples. So most lumps are not cancerous, but women should have them checked by a healthcare professional if you do have those symptoms, okay? So I will show you the picture of the symptoms after this. And actually, you can do it by yourself at home in front of the mirror. You can do it by yourself as the pictures shown after this. Okay, so cancer stage is according to the size of the tumor and whether it has spread to lymph nodes or other parts of the body. So we have 4 stages. There are different ways of staging breast cancer. One way is from stage 0 to 4, but this may be broken down into a smaller stage, okay? So stage 0, known as ductal carcinoma in situ, DCIS, the cells are limited to within a duct and have not invaded surrounding tissues. So when you are at stage 1, at the beginning of this stage, the tumor is up 2 centimeters across and it has not affected any lymph nodes. On stage 2, the tumor is 2 cm across and it has started to spread to the nearby nodes, okay? Stage 3, The tumor is up to 5 cm across and it may have spread to some lymph nodes. And the last stage, the final stage of the cancer has spread to distant organs, especially the bones, brain, liver, or lungs. So this will be very, very dangerous. So there are also some causes about the breast cancer. There are some risk factors that can be avoided and some can be avoided. Okay, so breast cancer usually starts in the inner lining of milk duct or the lobules that supply them with milk. From there, it can spread to other parts of the body. So the risk factor like age, the risk increase with age. At 20 years, the chance of developing breast cancer in the next decade is 0.6%. By the age of 70 years, this figure goes up to 3.84%. Okay. Number 2 risk factor is genetic. So this is what I tell you before, that some risk factor can be avoided, some risk factor can be avoided. So this risk factor we can't avoid it because it is genetic. If a close relative has had cancer, the risk is become higher. Okay, so women who carry the BRCA1 and BRCA2 genes have a higher risk of developing breast cancer, ovarian cancer, or both. Yes, both cancer. This gene can be inherited. The TP53 is another gene that is linked to a greater breast cancer risk. Number 3 risk factor is a history of breast cancer or breast lump. Women who have had breast cancer before are more likely to have it again, compared with those who have no history of the disease. Having some types of benign or non-cancerous breast lump increase the chance of developing cancer later on. Examples include atypical ductal hyperplasia or lobular carcinoma in situ. Number 4, estrogen exposure and breastfeeding. Being exposed to estrogen for a longer period appears to increase the risk of breast cancer. This could be due to starting periods earlier or entering menopause later than average. Between this time, estrogen levels are higher. Breastfeeding, especially for over 1 year, appears to reduce the chance of developing breast cancer, possibly because pregnancy followed by breastfeeding reduce exposures to estrogens. Okay. Risk factor number 5, body weight. Women who are overweight or have obesity after menopause may have a higher risk of developing a breast cancer, possibly due to higher level of estrogens. High sugar intake may also be a factor. Number 6, alcohol consumption. A higher rate of regular alcohol consumption appears to play a role. Studies have shown that women who consume more than 3 drinks a day have a 1.5 times higher risk. So women out there, please don't consume an alcohol because this is really not good and you can avoid this risk factor. You really can avoid this risk factor. Okay. Risk factor number 7, radiation exposure. Undergoing radiation treatment for a cancer that is not breast cancer increase the risk of breast cancer later in life. Okay, so yeah. Number 8, hormone treatment. The use of hormone replacement therapy (HRT) or oral birth control pills have been linked to breast cancer due to increased level of the estrogens. Number 9, occupational hazard. In 2012, researchers concluded that exposure to certain carcinogens and endocrine disruptors, for example in the workplace, could be linked to breast cancer. In 2017, scientists suggested that working night shift could increase the risk of breast cancer, but more recent research conclude this is unlikely. This is just a research, okay? So yeah, cosmetic implant and breast cancer survival. Women with cosmetic breast implants who are diagnosed with breast cancer have a higher risk of dying from the disease and 25% higher chance of being diagnosed at a later stage compared with women without implants. This could be due to the implant masking cancer during screening, or because the implant bring about changes in the breast tissue. More research is needed. So there are also many types of not many, just like 2 or 3 types of breast cancer. Breast cancer can be a ductal carcinoma. This begins in the milk duct, and this is the common type, just like I said before. And number 2, lobular carcinoma. So this starts in the lobules. Invasive breast cancer is when the cancer cell break out from inside the lobules or ducts and invade nearby tissue, increasing the chance of spreading to other parts of the body. Now, a non-invasive breast cancer is when the cancer is still its place of origin and has not broken out. However, these cells can eventually develop into invasive breast cancer. Breast cancer can also affect men, just like I said before, but it is less common in men than in the women. So mostly women will get this cancer more than men. Yeah. So next is diagnose. How you want to diagnose this cancer is, first you have to do a breast exam. This physician will check your breast for lumps or other symptoms, and the patient will be asked to sit or stand with her arm in different positions, such as above her head or her sides, or just follow the instructions. Next is imaging test. Imaging test, we have a mammogram, MRI scan, and ultrasound scan. So for a mammogram, it's a type of X-ray commonly used for initial breast cancer screening. It produces image that can help detect any lump or abnormalities. A suspicious result can be followed up by further diagnosis. However, mammography sometimes shows up a suspicious area that is not cancer. So this actually can lead to unnecessary stress and sometimes interventions. For ultrasound scan, it can help differentiate between a solid mass or a fluid filled cyst. And next one is MRI scan. Okay, MRI scans, it involve injecting a dye into the patient, so find out how far the cancer has been spread. The next one is biopsy. A sample of tissue is surgically removed from laboratory analysis. This can show whether the cells are cancerous, and if so, which type of cancer it is, including whether or not the cancer is hormone sensitive. So, diagnosis also involves staging the cancer to establish, like the size of a tumor, how far it has been spread, whether it is invasive cancer or non-invasive cancer, and then whether it has metastasized or spread to other parts of the body. So staging will affect the chances of recovery and will help decide on the best treatment options. So there are also many treatments. Treatments will depend on the type of your breast cancer, the stage of your cancer, 0 to 4, which stage do you, and then sensitivity to hormones. It also depends on the patient age, overall health, and the preference. So the main treatment options is radiation therapy, surgery, biological therapy, hormone therapy, and chemotherapy. So for surgery, we have lumpectomy, mastectomy, sentinel node biopsy, axillary lymph node dissection, and reconstructions. For the radiation therapy, this is actually a controlled doses of radiation are targeted at the tumor to destroy the cancer cells. A person may undergo this from around a month after surgery along with chemotherapy. So this really works to kill any remaining cancer cells. Okay, so each session lasts for a few minutes, and a person may need 3 to 5 sessions per week for 3 to 6 weeks, depending on the aim and the extent of the cancer. The type of breast cancer will dictate that type of radiation therapy, if any, is the most suitable. So it adverse effects include fatigue, lymphedema, darkening of the breast skin, and irritations of the breast skins. While chemotherapy also can treat a cancer that has metastasized or spread to other parts of the body, and it can reduce some symptoms. This is especially true in the later stage. Okay, so it can also reduce estrogen production, as estrogen can encourage the growth of some breast cancer. Adverse effect of chemotherapy may include you lost your appetite, fatigue, vomiting, sore mouth, your hair loss, and a slightly higher susceptibility to infections. Yeah, so medications can help control many of these side effects. However, alright. So next is hormone blocking therapy. Doctors usually use hormone blocking therapy to prevent recurrence in hormone-sensitive breast cancer. These are called estrogen receptive (ER positive) and progesterone receptor (PR positive) cancer. So they normally administer hormone blocking therapy is normally used after surgery, but they might sometimes use it beforehand to shrink the tumor. Okay, so the effect normally lasts for up to 5 years after surgery. However, the treatment will have no effect on cancer that are not sensitive to hormones. Example of hormone blocking therapy medications may include tamoxifen, ovarian ablation or suppression, aromatase inhibitors. Yeah. So hormone treatment may affect a woman's future fertility. So next is biological treatment. So this treatment targeted drug can destroy specific types of breast cancer. Example of such drugs include Herceptin, Tykerb, Avastin. Okay, doctors administer these 3 drugs for different purposes. So treatment for breast and other cancer can have severe adverse effect. Therefore, when deciding on a treatment, the patient should discuss with a doctor the risks involved and ways to minimize the negative effect. Okay, yeah. For the breast cancer outlook, with all the treatment, a woman who receives a diagnosis of stage 0 or stage 1 breast cancer has an almost 100% chance of survival for at least 5 years. Okay, if the diagnosis is made at stage 4, the chance of surviving another 5 years is around 22%. Regular check and screening can help detect symptoms early. Women should discuss their options with a doctor. Prevention. You have to prevent your breast cancer. Okay, so there is no sure way to prevent your breast cancer, but some lifestyle decisions can significantly reduce the risk of breast cancer and other types of cancer. Okay, so these include avoiding excess alcohol consumptions. Just like I said before, we are really not good in taking any alcohol. Okay, we are really not good in consume alcohol. Okay, And next is following a healthy diet with plenty of fresh fruits and vegetables. This you can consume because this is really good for your health, for your body, and it can prevent your breast cancer or any cancer, any types of the cancer. And then getting enough exercise, maintaining a healthy body mass index, your BMI. You have to maintain your BMI. You can get some enough exercise and follow all the healthy diet, and please avoid the excess alcohol consumptions. Okay, so women should think carefully about their options for breastfeeding and the use of HRT following menopause, as this can actually affect the risk. Okay, so preventive surgery is an option for women at a high risk. So yeah, that's all for today, and that it's only a little information about breast cancer. I hope it can help you. So thank you for watching.